So we try, you're on the same page as us. We try conservative measures. We want to exhaust those first before we go to more aggressive treatments. But it does happen. We say, I'm biased. I'm a physical therapist. I think I can fix anything when I get in the room. And I can't. There's a certain percentage of people. It's like we tried what typically works with this and it's not responding or it's getting worse. So that's why we're excited to have you. So in that situation where first we're going to go conservative and we've kind of gone through the 6 or 8 visits, it's not going in the course that we typically see it if the patient's going to recover, and we send them to you, what is treatment going to look like, and what are common things that people would expect when they have an appointment with you?
Absolutely, that's a great question. So first, I say, like I say, the story about pain management really comes down to listening. And one of the things my patients will tell you about our interaction is, I like to hear why it happened, how it happened, and I want to learn about you too, because pain could be from multiple etiology, whether it's from what you do at home, from how you play with the kids, and from just several things that make up who you are as a person. I really take the time to understand that. Now, recognizing that your environment really could be implicated in the etiology of your pain, one of the things that I also take the time to do after obtaining very thorough history and physical exam is to really discuss why you're in pain. And that could require getting an MRI, could require diagnostic tests like an X-ray. Let's take a look at the bones. Get an MRI. Let's take a look at the nerves. Is something pinching on the nerves? And sometimes we may even be specific to do like an EMG, where we can obtain sensitive and sometimes specific information regarding how your nerves should work. Now, when all of that information is gathered during the visit, the history, the physical exam, the diagnostic test, it is my job to come up with, hey, here are some of the possibilities that can explain why you're in pain. And the reason why that becomes really critical is because depending on the reason why a patient could be in pain, we could offer things as simple as, again, go back to physical therapy. I think your body looks good structurally. You just really need to go through the motion of strengthening your core, ensuring that your posture is in place, ensuring that the joints are in place. So, really, we can either say go back to physical therapy, or sometimes we can recommend medications to help with the pain. If it's a nerve related pain, you can prescribe nerve related medication. And even further down the line, we can recommend like cortisone shot. A lot of people talk about shots, and that shot can be so many things, from immunization shot to an actual advanced spinal shot, which can help with your pain, and even go as far as minimally invasive procedures that can help disrupt that spiraling cycle of the pain. So it's a plethora of options that we offer patients, but the visit usually typically looks like an interaction, getting to know the patient, listen to the problem, understand the problem, diagnose the problem, and then treat the problem.